Hi, I'm Randy. I'm with Boldly Me. I'm 25 years old, and I'm young enough to know how a lot of my friends and peers feel about the ongoing situation with the COVID-19 pandemic. I know some of us feel that this is a great opportunity to travel, go out with friends, take some time off from our daily lives, that we feel invincible and we feel like we can uh, survive this disease and go out without any particular consequence. It's a disease that affects a lot of people older than us. But I'm here to tell you a lot about some facts about COVID-19 and give some reasons why it's important to follow the shelter-in-place orders and the CDC authorities and stay home as much as possible. Just as a disclaimer, not a medical professional, and this is not medical advice. If you have any concerns about your health, you need to go ahead and contact your personal physician. So I'm just going to give some facts and answer some frequently asked questions that have been posed over the last few weeks. And one of the most frequently asked questions is this like the flu? And no, this is not like the flu. So this virus is a novel virus that has never been seen before in humans that just emerged back in December 2019. Furthermore, the flu has a general mortality rate of about 0.1% in the United States every year, whereas this virus, according to the data that we have right now, uh, this data that we have right now shows that the mortality rate for COVID-19 is around 2 to 5% overall, and it disproportionately affects certain age groups more than others. So, in fact, this is actually about 20 times more deadly than the flu. And not only is it more deadly, it's also way more contagious as well. So currently, what we know is that, like I just said, older people are being affected much more. Much more of them are ending up in the hospital, requiring a ventilator, requiring being admitted into the ICU. For instance, data from China shows that these age groups have a 14% mortality rate compared to some of the younger age groups. However, the issue that we're seeing here in the United States is that more and more young people are being admitted into the hospital. I think up to 20% of hospitalizations are patients aged 20 to 44, and that number is going up day by day. And just want to reiterate, I don't want to put a lot of fear into people, but 80% of cases are mild, involve mild symptoms. So mild symptoms basically involve anything short of requiring a ventilator or experiencing shortness of breath. So anything like coughing, fever, body aches, something that you might feel when you have a flu. But what makes this different is that in 20% of cases, patients develop shortness of breath. So they're very short on breath. It's very difficult to breathe, and they require supplemental oxygen or, in the worst cases, a ventilator. And at which stage, when a patient requires a ventilator, their odds for survival go a lot lower than, say, if somebody had mild symptoms. So, there are three general stages of infection. Most people end up in the first stage, which just involves mild symptoms. But by the time they get to the second stage, where they start experiencing shortness of breath, the illness tends to progress very rapidly, and we're talking rapidly within a matter of hours. And finally, in the final stage, your body's immune system reacts so strongly to the damage that the virus has created in your lungs, such to the point that patients are experiencing multi-organ failure, myocarditis, so enlargement of the heart, and a massive inflammatory response that fills the lungs with fluid. So, and unfortunately, right now there is no cure, and there is no vaccine. So, our best prevention methods are to stay home as much as possible because of shortages of widespread testing. You don't know if people you run into in the outside world have the virus or not. They could be asymptomatic carriers. We just want to make sure you don't take this for granted that every time you get sick, you catch a cold, catch the flu, you're going to get better in 7 to 14 days. But the scary part about this virus is if you get it, and it's a possibility you may end up needing to go to the hospital. And at that point, there isn't really much they can do for you there except support your body as much as they can, treat it symptomatically, and help your body fight off the virus on its own. So, it's really easy for a lot of us young people to take illness for granted or recovery from illness from granted with a cold and a flu. But, with these statistics, it's really a lot safer not to test the odds, follow the safety measures, stay home, so we don't overwhelm our healthcare system, so you can stay safe, so we can contain the spread of the disease and return to normal life as soon as we can. So I just want to thank you a lot for your consideration watching this video. Make sure you stay home, wash your hands, wipe down surfaces, tell your parents and your friends and anybody you know, stay home. We'll get through this together, and we'll be out of this hopefully sooner than later. Thank you.